That is 14 new cases since my update yesterday. 9 of those 14 cases are linked to known outbreaks, and 5 of those 14 are under investigation by our public health team. 1 has been reclassified. There are 482 active cases in Victoria. That's the first time we've been below 500 cases for a considerable period of time, and that is very pleasing. I'm sad to say there are now 781 Victorians who have passed away as a result of this global pandemic, 8 since my last report. 1 male in their 60s, 1 female in their 70s, 3 females and 1 male in their 80s, 1 male and 1 female in their 90s. 7 of those 8 deaths are linked to aged care. Can I, of course, extend my sympathies and condolences and best wishes to those 8 families. There are 58 Victorians in hospital. 8 of those are receiving intensive care, and 6 of those 8 are on a ventilator. A total of 2,635,282 test results have been received since the beginning of the year. That is 12,460 test results received since yesterday. That is another strong number, and again I thank those almost 12,500 Victorians who went and got a test the day before. Results are coming back within 24 hours, 90% plus are coming back within 24 hours. So we thank each and every one of those Victorians who came forward and got a test. Any symptoms at all, please go and get tested. Don't put it off for a day. Go and get tested today. It's the most important thing that you can do. Gives us a complete picture, allows us to take the safe and steady steps, and brings us steps closer to that COVID normal. That is a message that we have repeated many, many times because it's so important. Any symptoms whatsoever, as soon as you can register, as soon as you feel those symptoms, please go and get tested. You'll get your results the same day, or within a 24-hour period, I should say, and there are more than 200 test sites across the state. It is absolutely critical. These numbers are trending the trend is with us. These numbers are falling, and that is very pleasing. The strategy is working. We've got to keep those test numbers up so that the numbers that we get each day are, as best as possible, a true reflection of how much virus is out there in the Victorian community. There are 4,268 cases with unknown source. That's an increase of 1 since yesterday's report. There are 77 healthcare workers who are active cases. We send them our best wishes, and we thank them and all their colleagues for the amazing job they do every part of the state, every hour of the day. It is the most worthy of work. In terms of the metro-regional split, of the 14 cases today, 12 are in Metro Melbourne, 2 are in regional Victoria. That is to say they're recorded as being in regional Victoria based on the address, the postcode on their driver's licence. I am advised, however, that those 2 new cases that are linked via their address to regional Victorian postcodes, both those people acquired the virus in Melbourne and have not returned to regional Victoria. These cases will not affect the regional rolling average or regional cases with an unknown source. I can further confirm that there are 4 new cases in Greater Dandenong and 1 in Casey. I'm afraid I don't have further information as to whether they're linked to that Hallam cluster, but in the usual way that will come forward as part of the Chief Health Officer's media release later on today. In terms of active cases in regional Victoria, there are some 11 active cases in regional local government areas under the 3rd step. The rolling average to the 24th of September for metropolitan Melbourne is 25.1, and the rolling average in regional Victoria to the 24th of September is just 0.8. Again, those numbers are a credit to every single Victorian, no matter where they live, no matter their circumstances. The amazing work that Victorians are doing is what's driving these numbers down, and this strategy is being successful. It is delivering the outcomes that we wanted. In fact, has us in a position where I think we are ahead of schedule, but again, that'll be the subject of announcements and further commentary and other decisions that will be made between now and Sunday. I can't presuppose where we'll land on Sunday, but we're certainly well and truly within that 30 to 50 band in order for us to take those next steps. In terms of aged care, there are 247 active cases in aged care. I want to point out to you that the total number of deaths associated with aged care facility outbreaks is 619. That's an increase of 8 since yesterday's report, 7 newly reported deaths and 1 death that has been newly linked to aged care. That was not clear, it was not obvious, but that link has now been made, and therefore we have adjusted those tallies. Active cases in disability facility settings remain at 4. They are all staff. That, I think, is probably all I need to go through in terms of the numbers of the day. The Deputy Premier and Education Minister has joined me to speak about VCAL and VET students, so those students in the more senior years, and some arrangements we've made there. Just before I do that, though, can I just make a couple of comments in relation to Dean Jones? I think every Victorian is saddened to see such a great Victorian lost to us so young. Dean Jones was not just a great cricketer, but a great person, and I had opportunities to meet with him, and I always found him to be an absolutely fantastic Victorian, and I want to extend on behalf of all Victorians our condolences and our best wishes, our love and support to all of Dean Jones' family, and of course to all of his many, many fans. A great Victorian has been lost to us, and we all mourn that loss. I will, at the appropriate time, speak with his family about the arrangements that they think would be suitable. Obviously, COVID-19 restrictions do have a direct impact on the number of people who can attend a funeral service, but there may be a time, subject to the wishes of his family, where we as Victorians can celebrate a life well lived and a life that we are all diminished by the loss of. His passing is something that is a cause of great sadness. I'll now ask the Deputy Premier to speak to his announcements, and then we're happy to take any and all questions you have.
Terrific. Thanks, Premier. Morning all. So we've had, throughout the course of this year, a particular focus on Year 12 students. For all other children and young people from early years right through to Year 11, we've got time. We've got time to focus on their health and well-being. We've got time to catch them up academically if they need it, and we'll have more to say about that at a later time. But for our Year 12 students, this is it. This is their last year of schooling, and we want to make this a year of meaning and a year where their final result fairly reflects their ability and their efforts. A while ago, the Premier and I announced a range of supports for VCE students. So individual assessment of every single VCE student, any student impacted by coronavirus, that would be reflected in their VCE scores and their ATAR ranking. They'll receive their VCE certificate and their ATAR before the end of the year, so there is absolutely no disadvantage for those students compared to students across the rest of the country. Today, we're announcing support for students on a vocational path in Year 12, and there's a lot of them. They've faced some really unique challenges as a result of the pandemic and remote learning, and that's about access to practical hands-on learning at school, at TAFE, and at the workplace. And there's also the impact or the connection to nationally recognised qualifications, which I'll get to. So they've had, this is quite unique and quite complex. So firstly, we've got about 10,000 VCAL students in Year 12 where they have been unable to complete units as a result of the pandemic. They will be receiving a credit as part of a special consideration process. So the special consideration for our VCAL students, 10,000 of them, will look at the impact of remote learning and the pandemic on their ability to complete practical units. And this is all about hours for hands-on work, long absences, extra family responsibilities as a result of the pandemic, health of either the student or a family member, and of course mental health issues. So any student, any VCAL student impacted by COVID-19, that will be reflected. They'll receive credits for their units. They will get their VCAL certificate just as VCE students will receive their VCE certificate. So that's the 10,000 VCAL students. We've also got across VCAL and VCE students, so that's our 2 Year 12 certificates. Across VCE and VCAL, we've got about 15,000 Year 12 students undertaking a VET qualification. And a VET qualification is nationally recognised and federally regulated. So this is all about competencies, and you need to complete units of competencies as a pathway to further training and employment. So for example, a Certificate 2 in plumbing, pre-apprenticeship, you complete that Cert 2, and that shows an employer that that person has the skills and competencies to begin a plumbing apprenticeship. So in many ways, it's about safety in the workplace. You just must complete this work. So for VET students undertaking a VET qualification this year, if they've been unable to complete their VET qualification in 2020, we will guarantee them enrolment at a TAFE or dual sector provider in 2021, and we will waive their 2021 VET fees, which could save families hundreds and hundreds of dollars. So in a nutshell, every single VCAL student will be individually assessed and special consideration provided if they've been impacted by COVID, and they will receive their VCAL certificate. Every single VET qualified student, if they have not been able to complete their VET qualification, will be guaranteed enrolment at a TAFE or TAFE or dual sector provider next year. We're also doing a number of other things to support students on a vocational path. For VET students, we're providing them up until the 18th of December to complete their study. So we're providing them a further month at school. We're also will be providing students with their VET statement of attainment. What have they attained by the end of this year? And that will streamline and be recognised by TAFEs and RTOs next year. And finally, we're providing additional funding around $4.6 million to support students and families, whether that's with fee relief this year, cost of materials, cost of staffing, if they have changed their VET enrolment. So additional funding as well. I'm really, really pleased we've been able to get to this point. So we can say today that every single Year 12 student, whether they are a VCE student or a VCAL student, down an academic path or a vocational path, every single Year 12 student is being supported. Any impact of COVID-19 on their very final year of schooling will be recognised in their scores, in their certificates, and in their pathways beyond Year 12. I'm really pleased that we've been able to get to this point, and I know that it will mean a lot to all students on a vocational path, all their families, and I want to take this opportunity to thank very much all of our VCAL teachers in schools right across the state and teachers supporting students in their VET qualifications. So a great announcement today. Happy to answer any questions.
Take any questions that you have. Or not.
Premier, what sort of effect do you think this is going to have, this 2020 year is going to have on some of these Year 12s, and will it have a lasting effect?
Well, I've got a Year 12, we have a Year 12 in our household, and this has not been an easy year for our most senior students, and the point James has just made about it being that very last year. So whilst we have time, and we will make some substantial announcements about catch-up, filling any gaps for students who are coming back next year in those lower grades. But this has not been an easy year for Year 12 students, for our senior students, but that's why the special consideration approach that we've taken, so that no student is disadvantaged, the impact of COVID-19 on them and on their performance will be taken into account. That's very, very important. And it's important too that whilst that's there for those who, as the Deputy Premier just indicated, are pursuing a more academic pathway, that needs to be there as well for those who are looking to be job ready and to move into perhaps further training, but that training sitting alongside employment. So I think this is a very good outcome, but there's no diminishing how challenging this year has been. That's why a proper consideration and a detailed analysis of every single student, not the notion of just those who might apply, not the notion of those who in a normal year would normally get that close examination of not just their scores, but what sits behind that. Every single Year 12 student is being assessed with input from their teachers, with input at a very local level, and I think that's exactly the thing for us to do.
And do you think many children or students will repeat a year? Do we have the capacity to allow that?
Well, all the academic evidence from across the world shows that students do much better when they remain with their age-appropriate cohort, so they move forward with their peers. There will be some cases, as there is every year, where some students will need to repeat the year, but I think that the better pathway forward, this is what the educational experts and the experience from around the world shows us, the challenge, I think we can meet the challenge of filling in any gaps, and we'll have some further announcements to make about how next year might look a little bit different, both in terms of what's learnt and some of that intensive focus on some of the basics that students may not have attained throughout 2020. The important thing here is that, as James has just said, we have time with those students that are in the lower year levels. Obviously for Year 12s we need to move them through the year as best we can, support them. I would just make the point that I have had conversations with a number of Vice-Chancellors at various universities across the state, and they are very confident that the scores, which are a ranking, will be as meaningful as they ever are, and they are very confident that at the end of first year university, so at the end of 2021, they'll have everybody where they need to be in order to move into the second year of their course. That's no small thing, but universities, I think, have a high degree of confidence that they will be able to do that.
Premier, will Victorians today finally be given the answers to the key decision makers in the hotel quarantine scheme?
Well, I'm not going to presuppose what questions I might be asked, so therefore I can't really provide you with an answer to that question. That's a matter for the inquiry, and I would note that whilst today's the last day of hearings, as I understand it, the report of the inquiry, which gathers together not just evidence that's been given, but hundreds of thousands of pages of documents, that's not due for some weeks. Early November, I think, is when they're going to be providing that report.
Premier, is it acceptable to you that your health minister says she wasn't briefed on the hotel quarantine scheme and on infection control in the hotel quarantine scheme, given that infection control is a crucial part of that?
Rachel, I understand where the question comes from, and I don't want to be in any way difficult. I always endeavour not to be that way at all of these briefings, but out of respect for the process that I'm actually part of, I haven't just established it, which is a fact, but I will be appearing this afternoon, and I just don't think it's appropriate for me to be commenting on evidence that's been led or anticipating in any way questions that might be asked. My fundamental obligation is to answer the questions that are put to me today as directly, factually, accurately, honestly as I can, and that's what I intend to do.
How would answering them directly and factually now have any impact on
Well,
this afternoon?
I think you well know the answer to that question, Rachel. I will speak to the inquiry about the issues that I'm asked about. The time for us to reflect on the point you've made, the observation you've made, will be when the Board of Inquiry has produced its report. Out of respect for that process, I'm not going to cut across that today.
Rachel's question also goes to the broader, broader issue of whether the health minister should have been better across her portfolio. Yesterday she said that she did not seek updates on the hotel quarantine program until 2 months later.
Sure.
Is that acceptable?
Well, you're asking me to comment on evidence that has been led to the Board of Inquiry, and I'm afraid I'm not doing that.
I'm asking you whether it's appropriate for a health minister to wait 2 months to be updated on a program that essentially the department is the lead agency on.
I'm terribly sorry, Samaya. I'm appearing before the inquiry today, and I'm not going to canvass issues that I may well be directly asked about today, nor will I be drawing conclusions on evidence that has been led to that inquiry. That is not my role. That is not respectful of the process that's going on at the moment. I understand why the questions are asked, but if I try and write the report of the inquiry from this podium a month, 5 weeks before they will be actually handing down a report, the other point to make is that they have the benefit of having examined in some detail hundreds of thousands of documents, hundreds of thousands of pages of documents I should say, as well as having heard from many, many witnesses. I don't believe it's appropriate for me to
Have you-
pretend to
I
be
don't
chairing an
think
inquiry that I'm not
there's
chairing.
no sub-judice at play.
I'm not alleging that there is.
Well,
At no
how
point have I
would
indicated
you-
that I can't. I'm indicating to you in as respectful terms as possible that I won't, because I don't believe that is appropriate. I'm not writing the report of the board. I am appearing before the board, and I will not in any way make any comments that might be interpreted by anyone as trying to direct the findings of this inquiry, to direct the line of questioning of this inquiry.
No one's asking you to make those comments. We're just asking you to
Well, you're
answer
asking
simple
me-
questions about your minister's
You're asking me
accountability.
You're asking me questions, and it is my judgment that if I answer those questions, then I will be cutting across the work of the board, and I will be cutting across the findings that the board may or may not make. That's not something I'm prepared to do. I have nothing but respect for this process. That's why I am assisting the process this afternoon. There'll be a time for us to talk about all of these issues and more, and that'll be when we all have the recommendations, the findings, the final report of this board, and that is not for a number of weeks.
Premier, in the middle of April, caucus was told about the use of security guards. Jenny Mikakos was at a press conference at the end of March where Martin Pakula mentioned the use of security guards. How's it possible that she only knew about private security guard use in May?
What people knew, when they knew it, what people did, and the degree to which that was right, wrong or indifferent, that is a matter that the board is actively examining today and every day until they produce a report, which will be in early November. And I cannot and I will not pretend to be the chair of the inquiry. That's not why it was set up.
Is that a standard that the community should be satisfied with? This is a senior member of your government who seems to have vagued out at fairly key moments during the pandemic response.
Well, again, it is not for me to draw those conclusions today. Those matters, those and many, many other matters, they'll be matters that the chair of the inquiry could possibly make findings on. That is a matter for her. I know everyone wants answers. I want answers as well. That's why the inquiry was set up. But when you set up an inquiry, you need to be respectful of the work that's being done by that inquiry. And I don't believe it is appropriate for me to, as I said before, to attempt to make findings. It is not appropriate for me to pretend to be running the inquiry. I'm not. The inquiry is being run by others, as it should be. And I know it's frustrating that the final report doesn't come on the final day of evidence, but that's not the way these things work.
I guess we're not asking you to run the inquiry or to be the chair of the inquiry. They're just factual questions. The Victorian Health Management Plan for Pandemic Influenza, which also applies to when there are other novel viruses, so not the influenza, says, and I'm reading, the department's response priorities to a pandemic form the basis for the state controller's strategic intent, which is to limit the morbidity and mortality from pandemic influenza and to limit the impact on the health and well-being of the community by ensuring rapid and early detection of the novel virus in the community and controlling the spread of influenza through various containment strategies, including but not limited to isolation and quarantine. So clearly,
Yes.
Hotel quarantine, the isolation and quarantine, was the responsibility of the Department of Health and Human Services, was it not?
What you're asking me, Samaya, is to ignore the fact that the very subject matter that you are asking me about is currently being actively considered by an independent process.
I'm asking you.
I'm not finding fault with your logic that these matters you're asking on matters of fact. You're asking beyond that on matters of opinion and judgment, and I'm not questioning your ability to ask those questions. What I'm asking you to consider, though, is the fact that all of those matters and many more, whether they be matters of policy, principle, practice, or the performance of ministers and agencies, they are also, we surely all would concede, they are all being actively considered by an inquiry right now, live. It's not a thing. It's not like they handed their report down yesterday. They are actually doing this work now, and it's for them first to make their findings, make any recommendations, draw any conclusions they see fit to draw, and then there will be a time for me to speak on these matters and most likely many, many more.
But the chair of that inquiry hasn't prevented you from either answering questions, providing running commentary, as you like to call it. And I'm just asking you, when we have a Victorian health management plan for pandemic influenza, there's also been pandemic plans by the Emergency Management of Victoria as well, as you know. When they have all identified DHHS as the lead agency to controlling a novel virus outbreak, including the isolation and quarantine, why wasn't the Department of Health and Human Services right at the very beginning being given that lead agency role?
Well, this is where we're getting into, with respect and noting that I've just, I think on multiple occasions, what had gone wrong and to whom you could attribute that at the time I established inquiry. And then the chair and others will go away and write a report, and they will come back and they'll produce that report.
I'm not asking you to presuppose anything though. Jenny McCarkos and DHHS,
And
that's in the pandemic plan,
well,
so
that was
it
the
clearly
next
wasn't
point.
followed.
That was the next recommendations that Judge Cope makes. That is out of a respect for the process that I set up, and it is also, it should be noted, that given that I'm appearing later on today, and I in no way do I want to be going into that process where anyone might think that I have tried to guide that process, that I have drawn conclusions as a result of that process. It is not complete yet, and I understand your frustration, but I do not believe that's the appropriate way to go. It is not a matter of being prohibited. It is not a sub judice issue at all. The fact that well, there's any recommendations that they might see fit to give to us, and then it will be my responsibility at that point to take the action necessary to ensure that mistakes do not occur again. That's the responsibility I have.
Premier, the budget for the hotel quarantine inquiry was $3 million to start out. Is it still at that?
I'm not aware that a request for further funding has been made. I'm happy to try and confirm that. I'm not aware of one. I almost certainly would be if there had been, but I'm happy to check the record and come back to you if I can.
The funding for the lawyers who are representing each government department comes from outside that budget. How
Correct.
and when will Victorians find out how much money has been spent by each government department on these proceedings, on providing legal representation to you and your colleagues?
Well, there are 2 points to make. Firstly, in direct answer to your question, in the usual way, which is through the annual reports of those
So in a year
departments. Well, in the annual reports of those departments. When those annual reports will be tabled is not a matter that I determine. They'll be tabled in the usual way. The second point to make is this practice is no different to any other inquiry or similar process for decades and decades and decades. And that's the fact of it. To assert otherwise is simply not right.
Yesterday you said that you have confidence in all your ministers. Following your health minister's evidence at the inquiry yesterday, is that still the case?
Yes. And if that were to change, then ministers would not be ministers. That's why they're ministers, because I have confidence in them. And if that at any point changes, then that changes.
How can you have confidence in her when she clearly didn't seek updates on key elements of the hotel quarantine program?
Well, again, Samaya, you're asking me to...
No, I'm just asking you why you have confidence in
Well,
her.
I've answered the question, and I don't propose to run through a list of different features that see me to the point where I have confidence in all my ministers. I do. That's the answer to the question, and I think that you're essentially asking me via another device to be a commentator on evidence, and it is important. That's why people, when they're asked to appear, go and appear and answer questions. But it's not for me to be drawing conclusions or making findings on evidence that's been led. That is, after all, I think pretty logically, that is why the inquiry was set up. That's the work they're doing, and it is for them. In the first instance, there'll be a day when you can ask me what I think about all these matters and what I'm going to do about all these matters, but we have to have those matters settled first. I can't speak to a report that hasn't been written yet. I simply can't.
Again, with all due respect, I'm not asking you to comment on the hotel quarantine inquiry. I'm just asking you why you have confidence in your health minister.
No, that's not the question you asked,
Putting the
Samaya.
hotel quarantine program aside, why do you have confidence
With
in her?
with an equal amount of respect, can I say to you, that's not the question you asked. You said, in light of various things, how was it that and I think I've answered that question.
Are we any closer to knowing what Sunday may look like and any announcements?
Sunday, yes. We are working through all the numbers that have come to us throughout the week, the trends, the chains of transmission, the types of cases, the story, if you like, that sits behind each of those cases. Tomorrow will be a long day, and I think probably well into the evening, but we're very confident that we can take some safe steps, not big steps. I just want to be very clear. The roadmap never envisaged really significant steps at the 28th, but we are on track. The strategy's working. But I do hope to be able to talk a little bit more about how I think October will unfold, and maybe give people some clarity around, because we're ahead of schedule, what might be possible. Again, always subject to the case numbers. What might be possible in the next month as we move towards that next trigger point. That may be able to occur sooner, but I'll be in a better position to speak to that in some detail on Sunday. But Sunday, just for clarity's sake, Sunday will not be a day where we are throwing the doors open and everyone gets to go back to COVID normal. We haven't got to that point yet, but the good thing, the positive thing out of these last few weeks since we announced the roadmap is we are ahead of schedule. We are, when I say we, all Victorians through their amazing efforts and their enormous sacrifice are driving these numbers down. They're not low enough yet, but they are certainly moving that way. And that then means many things become possible and potentially earlier than we had thought.
Is there any chance that perhaps either the curfew or the 5K radius may be changed on Sunday?
I can't really comment on those matters until they're settled, but I think they would, certainly the 5Ks would be more in the significant decision that's probably beyond the scope of the 28th. But again, that's my view at this stage. We still haven't had, no decisions have been made. That's the point I'm trying to make. They will be made, and we'll make those announcements on Sunday.
Could I just clarify?
Sure.
The 5 cases in the southeast that you mentioned, are they also the cases where there's no known link to an outbreak?
No, I can't confirm that. The show release will be able to break down the 14 and take you through the categories in which they all sit, and where there are links, then that'll be listed. Where they're still under investigation by the public health team, then that similarly will be listed, and then we'll close those out once that work is done, and hopefully that can be done quickly, and I can bring that to book, as it were, in the next few days. I just thought it was appropriate to make the point that there are those cases that can be linked to that, in general terms, that part of southeastern Melbourne. Whether they're linked to the Hallam outbreak, whether they're whether they're contained or under investigation, I can't give you that level of detail, but the show release will be able to do that.
There are legal proceedings afoot against the curfew. It'd be a bit cynical for you to remove that curfew just ahead of it possibly being legally quashed, wouldn't it?
I wouldn't make that judgment. I think that there are some people that are not big fans of that. This is a strategy that's worked. It's a strategy that's made the very important work of Victoria Police just a little bit easier. And I just don't think there's any. I don't think you can deny the fact that we have seen less movement. We have seen less of some of the activity that we know spreads this virus. But again, it is best. I take no joy in having to make this comment, but that, as you rightly point out, that matter is in the courts right now, and I'll leave it to others to argue the various perspectives they have on that matter.
Premier, will you be announcing any workplace changes before Sunday?
Potentially. I think we had a discussion yesterday about a number of high-risk industries. Those matters are still being very closely looked at, and I think they will be a feature.
So distribution centres, meat works and the like can expect tomorrow to have an announcement for more workers allowed on site?
No, those announcements will be made on Sunday, and to the extent that they're relevant to those sectors, those matters are not finalised yet, but we're certainly looking very closely at those things, and I want to get those high-risk workplaces to the highest level of activity, but still keep them as safe as possible. That's the balance that has to be struck, and I think that we're going to be able to get there.
So given some of those industries weren't due to have any changes until the end of November, and you're now looking at bringing that forward, how is 1 day notice really going to be enough for them to get staff back on site?
Well, they'll get as much notice as can be provided to them, if there is in fact a decision to that end. So I'm not making that announcement. We did have a lengthy exchange yesterday about how important it is that we get those numbers up. we're looking at that actively, carefully, and when we're in a position to make announcements, we will. And the nature of these things is, if I could be so bold to make a comment in my conversations, particularly with the supermarket industry, I don't think they'll be complaining. They'll be very pleased if that's in fact what we can do. I don't think any of them will say you've given us no notice. They'll be very pleased with the fact that we've made a decision once the data told us that was a safe decision to make. I don't think there'll be criticism. I can't speak for every sector or every business, but that's not the feedback I'm getting.
Why was Melissa Skilbeck stripped of some of her responsibilities over COVID?
I think I've been asked this question a number of times, and I've indicated to you that those matters are rightly and properly the province of the Secretary of the Department. She doesn't report to me, she reports to the Secretary of the Department, and then the Secretary of the Department makes decisions about where she can be most usefully and effectively deployed.
And has that Secretary of the Department, Kim Peake, did she explain to the Health Minister or the Crisis Council of Cabinet why Melissa Skilbeck had to go from that role?
No, and I can't speak for the Health Minister, but it's not a matter that a matter like that would not be drawn or be the subject of discussion at a committee of Cabinet's mayor, because it's not a decision of a committee of Cabinet. It's a matter for the Secretary of the Department. They engage and deploy staff across many different functions, and it's entirely a matter for them.
Is the coronavirus blowing out costs on major projects because of work restrictions and?
Yeah, look, there's no doubt that the virus is affecting many projects, many industries. The exact nature of that won't be able to be determined in kind of aggregate effect until we get to other stages. But certainly there's impacts. There's impacts everywhere. I think every Victorian knows that, whether it's in your family, in your household, in your suburban community, in workplaces, on projects large and small. There are significant impacts of this, yes.
Do you expect the government's going to have to stump up more cash to help resolve that?
I think some of these come with a cost, not necessarily all, but we'll try and reflect what we need to do to take account of that when the budget is handed down.
Bendigo Businessman has taken out an ad campaign criticising you quite personally. What do you think of that campaign?
I haven't seen the campaign. I understand it was some ads were run in some rather popular TV shows. I wasn't watching those shows. People are free to have their views. Advertising or criticism doesn't really work that well against this virus. I wish that it did.
It was quite personal, especially targeting you. What do you think of the tone of that sort of campaign?
Not having seen the campaign, I really can't comment. And maybe I should put it this way. I don't know whether it is personal or not, but I can confirm for you that personal abuse doesn't work against this virus either.
Do you imagine our international borders opening up to international students anytime soon?
Borders obviously are a matter for the Commonwealth Government. As I understand it, there is a trial going on in South Australia at the moment. We know that international education is a really important part of our story. It's a big part of our Victorian economy. So we want to get that back to something approaching normal as soon as we can. But again, that, like all things, has to be done safely. And border issues, whether that be limited opening to, say, New Zealand or our region, or borders being much more normal, if you like, that I think we're still some way off from that, and that'd be a matter that'd be made, the decision that'd be made by the federal government, but it would be communicated, I would expect, through the National Cabinet as well.
I've got a question for the Education Minister.
Certainly.
Is there any consideration or move being given to kids going back to school earlier than the current plans?
Not at this stage. As I've said before, it's entirely dependent on the case numbers, the advice from public health. So at this stage, the first week of term 4, the 5th of October, is remote learning for all students other than senior students undertaking the GAT on the Wednesday of that week and other school-based assessments. The following week, the 12th, Prep 1s, 2s, Year 11s, 12s and Year 10s undertaking VCE or VCAL subjects. Beyond that, for Years 3 right through to Year 10, that will be entirely dependent on the numbers and the advice that we receive.
Can I ask about the credits that BCAA will be granting students? How high will that bar or that threshold be? Will kids need to make like several of some of these impacts that you've listed here?
Yeah, so this will be an individual assessment, and that's the importance and the beauty of what we're announcing. Individual assessment of every VCE student, every VCAL student. So it'll be an individual assessment about the impact of COVID-19 on that student, based on whether it's been a school closure, impact of remote learning and their ability to undertake hands-on practical work, either at school, at TAFE or at the workplace. Students need to have shown reasonable progress, but that will be a school-based local decision in conjunction with the VCAA.
Are you still confident that you'll be able to do all that special consideration in time for when they'd be getting the results normally?
Yeah, absolutely, and that's been the real focus for us. How do we? And we wanted to work backwards. So ATAR ranking before the end of the year, VCE certificates, VCAL certificates before the end of the year, and what time and support do we need to provide schools so they can do that individual assessment. So we're clearing the decks, if you like, and making it clear to principals and to teachers, senior teachers. You've got to have the time to make that individual assessment of every one of your Year 12 students.
Premier, one on the decreases people will be experiencing in the coming days with their JobKeeper, JobSeeker payments. I guess, what do you say to people in the community who are now going to be suffering more financial hardship because of this argy-bargy between the state and federal governments?
Well, I wouldn't describe the relationship with the federal government in those terms. They've made a decision and they can speak to why they've made that decision. That's not a decision that I've made. We just announced the biggest package of business support that the state's ever seen only a couple of weekends ago. In terms of the rate of JobKeeper, that is entirely a matter for the federal government, and those questions should be referred to them.
But it is going to be affecting Victorians
There's no
more
question about that,
than
but
anyone else.
Well, I don't determine the rate of JobKeeper or job seeker, and I'm not in a position to do that. That is a matter for the federal government, and the federal government are the ones who've made that decision. And well, the federal treasurer, he's out quite often. He has lots to say about all sorts of different matters. I think that probably he should be the one that you would speak to about that.
You represent Victorians. Have you lobbied the federal
I
government
do.
to consider...
I've had conversations with the Prime Minister. I don't.
Have you asked them to expand the program for Victorians?
I don't propose to go into the details of discussions I have with the Prime Minister, but I have made it very clear that there is a significant need in Victoria, and we would very much welcome the continued assistance of the Commonwealth in meeting those needs. I can only draw you to the Prime Minister's own comments. We're all Victorians, so if you want to know what's been done and why, then I think Josh Frydenberg, who's a Victorian as well, is exactly the person that you should speak to. Beyond that, we'll always lobby for additional support for our state. I think it would be fair to say that has been a feature of the work that I've done over these last 6 years and many years before that. They've got a federal budget coming up, and I think it's a fair conclusion to draw from some of the things that have been pre-announced and some of the commentary out there that there'll be significant support for all of those impacted by COVID-19, not just in Victoria, but indeed right across the nation.
And will you be designing or announcing an economic stimulus package or business survival packages for both employees and employers in coming months or coming weeks?
The budget, as I've said a few times, a very big feature of the forthcoming budget will be jobs, investment, confidence, repairing the damage that this pandemic has done to us, and making sure that we can have growth and look after all of those who've been touched by this. That will be a feature, and it is fair to say, without pre-announcing our budget, it is fair to say that it will be in unprecedented terms. It will be a package the size and scale of which this state will never have seen before, because that's the nature of the challenge that we face. When the rates of JobSeeker and JobKeeper are cut, particularly Victorians, they're going to lose a lot of disposable income. So I was just wondering if there are any plans for like a one-off stimulus
for Victorians to get the economy maybe going or to put some extra cash into their pockets?
There'll be a budget soon, and the budget will detail all of our plans, and they will involve, as I said, jobs and repair, but also capitalising on our core strengths and actually creating some new ones. That's the sort of work that we're going to do. It'll be infrastructure, large and small. There will be some support for individual families as well. We know that there are many people out there doing it tough, but I'm not in a position to make those announcements today. Not for any other reason than those matters have not been settled. We are well advanced, but we have not settled on those things. And income support, if I take it, that's what you're talking about. That is primarily a function of the federal government, and it should be. They're the ones with the data. They're the ones with a payment system that's long-standing practice. But where we can add to, in a long-term sense, some of the things the federal government will do, complement those sorts of things, then we always stand ready to do that.
Premier, will international travellers or flights be banned from coming into Melbourne until after that report and into the inquiry is handed down?
I don't believe that we'll be receiving international flights until we've got the report. Doesn't make any sense to...
And that will be extended from October 24 then?
That would be my expectation, yes. Makes no sense to ask for an inquiry and recommendations and then have planes landing when you haven't received that report.
And how long would you anticipate after the report before that scheme could get back up and going again?
It depends on what's in that final report in terms of what system, what structures, what topics they go to. We've reset the program. We are doing some work in the background to make sure that we can, in answer to your question, we can respond to the report as quickly as possible, but it's not possible for us to anticipate what will be in that final report. So I don't think there's ever been any doubt. I've tried to be as clear as I can on multiple occasions that we will wait for that report before I ring the Prime Minister and say flights can come back. We need to be absolutely certain that whatever system is in place, I should say, that it's as robust as it possibly can be.
What work is going on in the background?
Sorry?
What work is going on in the background as part of that, resetting that scheme?
The nature of background work is when I've got an announcement to make, I will. And I can foreshadow for you that won't be before the inquiry hands down its report.
Have you had any pushback from your counterparts in other states about the fact that they're kind of bearing the brunt of paying for these, for hotel quarantine?
No, nor did we provide any when we received more than 20,000 people, which was obviously a lot more than many other states did. So this is a national effort, and I'm very grateful to them. But I've certainly had nothing but a cooperative partnership with each of them.
I guess back on the issue of JobKeeper and JobSeeker, Australian taxpayers are being asked to foot the bill for the fact that Victoria had a second wave. Obviously, a lot more Victorians are receiving JobKeeper and JobSeeker than would have been had we not had that second wave, which did come out of hotel quarantine. Do you apologise to them for that?
Well, I have apologised on multiple occasions. I'm very sorry that we find ourselves in a situation where we've had to put restrictions in place to bring these numbers down. I've been very clear about that. So what I'd say is that the best thing we can do, whether it be in terms of income support, our economy, getting back to that point where we drive the national economy, which is the story of this state in recent years, the best thing we can do is to continue to drive these numbers down. Don't open too much too soon and find ourselves back in this circumstance in just a few months' time or maybe even a few weeks' time. That's what we're focused on, and that's why it's so pleasing, no doubt, not just for Victorians but for everybody across the country to see these numbers falling. That's the most important thing, and I'll make the point, as I have many times, you can't hope to keep the numbers low unless and until you first get them low, and that's what the strategy's making possible. There's pain, there's many challenges in that, but that's the only alternative that is available to us.
Just some media reports this morning about PSOs carrying around capsicum spray when they shouldn't have been. It looks like they need an exemption from the Control of Weapons Act, and they only got that this week from the Minister. How do you explain that sort of oversight?
I can't explain that. That's an inadvertent matter, and I think Victoria Police have, if they've not already spoken to that, they will, because they're the people at a very deeply operational level to be able to explain that. I haven't been formally briefed on it. I've been told that it's an issue, but I understand it's being fixed, but it was an inadvertent issue. I think VicPol's probably best to speak to that.
If people have been capsicum sprayed by PSOs, could they expect compensation or an apology, do you think?
Well, that's a matter for Victoria Police. use of capsicum spray is to avoid using far more lethal means. I don't think any officer or PSO uses capsicum spray lightly. It is about de-escalating, but also making sure that everyone is as safe as possible. The alternative, of course, is to use lethal force, and that is not something that any member of Victoria Police would ever do lightly. So it's about a graduated series of different interventions that can be made to keep the public safe, but also to protect the officer or officers who are doing that important work. So I wouldn't be critical of capsicum spray and its use. It's done as carefully as it possibly can be. It's a proper judgment made about whether that's warranted. As to this inadvertent issue, the best people to speak about how that's been resolved and how meaningful that has been, that's a matter for Victoria Police, and I'm sure they'll be more than happy to speak to you about that.
Would you be asking the Minister to look into how this all played out?
I expect that'll just be the normal process. People will look at what has occurred and they'll do their best to make sure it doesn't happen.
The ministers and public servants who were responsible for the system that brought us hotel quarantine, not that we've found out who that actually is yet, are still responsible for our pandemic response. Are you prepared to wait until, I guess, are you confident that they can take care of that and do that properly given what we've heard in the inquiry? And are you prepared to wait until November to find out, what went on, without finding out, without being confident of what they're in charge of going forward?
I think the answer to your question, two questions, is yes and yes. If I didn't have that confidence, then they wouldn't be ministers. Simple as that. And I just go back to the point I've made a few times today. I'm not going to write the report of the board. I'm not going to anticipate what's in the report of the board. It is open to the board. My understanding is it is open to the board to produce interim findings. It is open to the board if they felt there was a matter of some urgency. Again, I'm not directing them. I understand they have many different options open to them, and that is entirely a matter for them. The issue here is that having set up a process to get answers, then we need to let that process run its course. And whilst you're putting it to me that there have not been answers delivered to this point, the findings of the board may be very different to that. They're the ones who've read through 200,000 pages of all manner of different documents. They've heard from many witnesses, and it's up to them what findings they make. So what you're putting to me is missing now may not be in the future. That's why you wait. That's why you wait to see what the board comes back with.
Suburban contact tracing hubs, the two that are yet to be rolled out. Do you
Yes.
have any more info on that?
No, I don't. But when I can give you those answers, I will.
Are you able to reveal which hospitals or health centres you're in talks with in Melbourne's north and east at the moment?
No, but I think it logical that Eastern Health will be part of that discussion and Northern Health will be part of that discussion. And as soon as those matters are confirmed, I'll be more than happy to do that, just as I did the other day where there was some questioning about it. I think the very next day I was able to give you 3 of those. The other 2, if there finishes up being 2, I'm more than happy to confirm that once those arrangements are settled, which I don't think will be very long.
At the start of this week, you said that you expected those 3 hubs to be fully rolled out by early next week. Is that still the plan?
Oh, not quite fully. I think I might have made the point. Again, you can correct me if I'm wrong. I think I might have made the point that they would start probably at a lower level than where they'll get to. They'll have to peak, but I think we're on track for that. Monash Health's already doing that work pretty much. Western Health has been doing quite a bit of community engagement and some other contact tracing for us. I think probably if you were to say who gets biggest quickest, I think the third in that list would probably be Austin. But when I can provide you with an update, I will, and hopefully I can combine that with the other 2.
Can I ask James Molino another question,
Sure.
please? El Taqwa was obviously one of our biggest clusters. It happened in a school. Can you walk us through, I guess, how confident were you in DHHS's ability to be able to contain that cluster that obviously grew to a sizable grew quite sizably, and also managed to get its way into the public housing towers.
So in terms of Al-Taqwa, which was part of a broader community cluster, most of our other schools, the numbers were just one or two cases, and the team at DHHS, particularly when DHHS established a specific team just focused on early childhood and schools, in terms of timing with contact tracing, ensuring the deep cleaning is done and getting those schools open, the results were fantastic. And I was just advised yesterday that every single school that was closed down, and there was a couple of stubborn ones in terms of chasing down those doing the contact tracing and the like, every single school is now back open, so ready for kids when they come back to school at the start of term 4.
And when was that sub-team established within DHHS?
I can come back to you, Samaya, with the exact date that it was established, but it was a great move. A dedicated team solely focused on early childhood and education settings, and great results in terms of driving down those numbers of schools that had closed for contact tracing and deep cleaning.
I might just add, Samaya, that as I understand it, part of the recent visit to New South Wales, it was of some interest to our colleagues in New South Wales that when it came to outbreak management, we had embedded within public health teams people who had policy expertise for whether it be in education or in different industries, for instance, different settings. So it wasn't just public health practitioners, it was also people who had a very acute understanding of how school works, how factory works, how meat works, operates, things of that nature. So that improvement here will no doubt influence others in the response that they deal with when there's the inevitable outbreaks and inevitable cases that are part of actively suppressing this. Any other issues? If not, I'll see you tomorrow.
Yeah.